Have you ever wondered what is considered a normal penis size? Or perhaps you are curious about how to measure it accurately. Maybe you have concerns about your own size or want to learn about penile enhancement procedures. You're not alone. Today, we will discuss a topic that often brings up curiosity, anxiety, and unfortunately, a lot of misinformation. Before we dive in, I want to clear something up. The content of this video is meant purely educational. I am not a doctor, and if you have personal concerns about your health, please consult a medical professional. Now let's continue. The idea of normal penis size is a surprisingly complex one. When it comes to the human body, there is always a wide range of what is considered normal. Yet somehow, when it comes to penile length and girth, the pressure to conform to a certain standard seems amplified. Let us begin with some reassurance. Around 95% of men who worry about their penis size are actually within the normal medical range. In most cases, it is not a physical problem, but a distorted body image. Many men feel inadequate due to unrealistic comparisons, especially from adult films or online sources where bodies are often exaggerated or digitally altered. Interestingly, this concern is much more common among men than women. About 55% of men report dissatisfaction or anxiety about size, while only 5 to 10% of women say it is a very important factor in a partner. So take a deep breath. My goal is to educate, inform, and most of all, put your mind at ease. In this video, I will share real scientific data, explain how to measure both length and girth properly, explore enhancement procedures and their risks, and even present a surprising historical insight that could change how you view this topic altogether. How to accurately measure penis size. There are two key dimensions, length and girth, which is circumference. Both are important. Measuring length. Penis length is measured either when erect or flaccid and stretched. The most consistent and reliable method used in medical research is flaccid stretched length, as it closely correlates with erect size. Steps to measure length. 1. Use a ruler or measuring tape. 2. Place it at the pubic bone where the penis meets the body. You may need to gently press into the fat pad. 3. Stretch the penis outward firmly but not forcefully, and measure to the tip of the glans or head. The same technique applies when erect. Just align the ruler on top of the shaft from the pubic bone to the tip. Avoid measuring from the skin or underneath, which leads to inaccurate results. Measuring girth circumference. Girth can vary more than length. To measure girth. 1. Use a soft measuring tape or a piece of string. 2. Wrap it around the midshaft, not the base or tip. 3. Record the measurement where it overlaps. This can be done in both flaccid and erect states, but erect girth is the standard used in most studies. Many men overestimate or underestimate their size due to poor measurement methods or unrealistic comparisons. What does the science say about average size? A large meta-analysis of nearly 15,000 men worldwide combined data from multiple studies to get accurate averages. Average length erect or flaccid stretched. 90 to 95% of men fall between 10 to 16 centimeters or 4 to 6'3" inches. Global average length is about 13.2 centimeters or just over 5 inches. Medical definitions. Micropenis less than 75 centimeters or 3 inches when erect or stretched. Macropenis more than 24 centimeters or over 9.5 inches. Extremely rare. Average girth circumference. Flaccid girth is between 8 to 10.5 centimeters or 3.1 to 4.1 inches with an average of 9.5 centimeters or 37 inches. Erect girth is between 10 to 13 centimeters or 39 to 51 inches with an average of 11.5 centimeters or 45 inches. Most men fall within these ranges. If you do, you are entirely normal. And even if you are outside it, it does not define your health, desirability, or masculinity. A lot of anxiety stems from unrealistic standards, especially in adult media where angles, editing, and selective casting distort reality. If you have experienced frustration in the bedroom, whether related to stamina, desire, or performance, you are not alone, and it is not your fault. There is a 100% natural method that has been helping thousands of men regain confidence, firmness, and drive. It is a quick 7-second technique done at home which supports what researchers are calling the manhood molecule, a key trigger for arousal, blood flow, and performance. To learn more, scan the QR code on screen or check the pinned comment below for a video explanation. Penile enhancement procedures. What's safe? With growing curiosity about enhancement, it is essential to separate facts from marketing hype. Girth enhancement. Increasing thickness. One popular method is injecting hyaluronic acid, a naturally occurring substance also used in facial fillers. It can temporarily increase girth by 2 to 3 centimeters and lasts 12 to 18 months. It is considered safer than permanent substances. However, non-absorbable fillers like PMMA or industrial silicone are dangerous. They can cause chronic inflammation, lumps, deformation, or irreversible tissue damage. These are not recommended by reputable medical professionals. Lengthening procedures. 2 common approaches. 1. Liposuction of the pubic area. This removes fat, making more of the shaft visible. It does not increase actual length. 2. Suspensory ligament release. This surgically detaches the ligament attaching the penis to the pubic bone. This may add 2 to 2.5 centimeters in flaccid state, but not when erect. It can also cause instability during sex and potential complications. There are no permanent medically approved procedures for real penis lengthening recognized by most health organizations. Also, penile implants are not for size enhancement. They are medical devices used for erectile dysfunction, a historical perspective that might change everything. In ancient Greek culture, the ideal male body was shown with smaller genitals. This symbolized wisdom, discipline, and rationality. In contrast, large penises were often seen as barbaric or used in comedic or mythological depictions like Priapus, the fertility god with exaggerated anatomy. Why does this matter? It shows that ideas about masculinity and size are cultural, not biological truths. What is ideal changes with time, and much of today's anxiety is shaped by social media and pop culture, not science. Lastly, penis size does not define your worth, your masculinity, or your ability to satisfy a partner. What truly matters is confidence, mutual respect, and health, both physical and emotional. The content in this video is meant for educational and informational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always consult with your doctor or a qualified healthcare provider if you have any questions about medical conditions. Never ignore or delay seeking professional medical advice because of something you've seen or heard on this channel. If this video helped you see things differently, please like, share, and subscribe. Do not forget to turn on notifications for more judgment-free, science-backed content. Thank you so much for watching, and I will see you in the next video.